Ever had that sinking feeling where you go to cough or lift something and suddenly you're leaking urine that you can't control? That is called stress urinary incontinence, and it's incredibly common, especially after you've had something like a bladder or a prostate surgery. Trust me, you are not alone in dealing with this. It's embarrassing, frustrating, and it makes you second guess the things that you used to do in your everyday life. But here's the good news. There's a simple, evidence-based technique known as the Knack that can help you take control of your condition. And today, I want to show you how it works. Stress urinary incontinence happens when there's increased pressure in the abdomen, like during coughing, sneezing, or lifting. And in some extreme cases, it can be as simple as going to bend forward when you're sitting on the couch. The urine leaks because the muscles and the tissues that normally keep your sphincters closed aren't functioning optimally. In men, this often happens after prostate surgery because the surgery can affect the internal sphincter and the surrounding muscles that help control urine flow. The pelvic floor muscles are still there, but they need retraining to take over that job while your automatic internal sphincter mechanism control recovers to the extent that it will recover. However, stress urinary incontinence can happen in younger men whose control strategies have worsened over time. So let's get right into it. The Knack is the skill of gently contracting your pelvic floor prior to you doing any task that involves increasing intra-abdominal pressure. These are things like coughing, sneezing, standing up, maybe vomiting, or lifting something. Specifically, recruiting the external urethral sphincter and bulbocavernosus are two regions that we want to focus on, as they help maintain that urethral closure, preventing the leakage of urine. So step by step, before you go do a task that involves that increase in pressure, gently tighten the pelvic floor by thinking about shortening the penis into the body and gently stopping the flow of urine. Hold that contraction just before you're about to do your task, and then you can go relax. Keep in mind that for now, I want you to do that exact same Knack strategy for every task that involves increasing pressure in the abdomen. Now, I fully recognize that this task can seem like a bit of a mental chore to learn how to contract your pelvic floor on what used to be normal everyday tasks. But I like to equate this task as buckling the seatbelt before you go for a drive. Let's think back to the time where you just got your license and started driving for the first time. You stepped in the car and made that mental note to buckle that seatbelt before you started the engine. And then as the weeks went by and you continued to drive the car, how often did the thought of buckling the seatbelt come to the forefront of your mind? Probably never. We just stepped in our car and buckled the seatbelt without even thinking about it. Just like buckling the seatbelt, by practicing the Knack constantly, the mental effort reduces every time, and eventually we will have trained ourselves to make this motor pattern automatic. Now, if we're talking about stress urinary incontinence for the post-surgical people, many men will think that this post-surgical problem will just go away over time. While time helps, active training can make a huge difference. Your brain and muscles learn through repetition, and using the Knack strategy can get you back to being leak-free faster. So I hope you found this video helpful. The next time you go to lift, cough, or sneeze, remember the Knack strategy. A few seconds of pelvic floor contraction can make all the difference for your urinary leakage. Hit like and subscribe, and check out some of the other videos I've made on urine leakage and overactive bladder. Thanks for watching.